I'm 53. I've been using a Retin-A since my mid-20s. I feel like I don't have a lot of lines on my face because I don't do a lot, but the things that I do try to do is always good skincare, take care of your skin, and Botox. If you can stop the muscle from moving, then you're not going to get a line.
This is the Home of Healthspan podcast, where we profile health and wellness role models, sharing their stories and the tools, practices, and routines they use to live a lively life.
Raquel, welcome to the Home of Healthspan today. I'm excited to have you on, and not just because of my vanity and I want to learn all the beauty tips, but because I do think it is kind of a window to our health as well. But before we get into that and everything that you do, how would you describe yourself?
Okay, so I am a lively, aging female. Can I say that?
You can say whatever you want.
Right. I mean, in an ageist kind of society, I am trying to age not backwards, but definitely forward with health and longevity would probably be the best description.
And I love that description because of the health and longevity side. So I think I want to preface this by, some people say, oh, there's certain cosmetic things you do for health reasons, and others it's vanity. And I don't know if vanity is a problem. It's your body. You should be able to do, I would think, whatever you want to do. It's your body. You're not harming someone else. So I think it's a false split between these things. But the flip side as well is on the health side, there have been numerous studies that people who look younger are rated objectively by people in studies as looking younger are also healthier by all the internal biomarkers that we have. And so when you say aging, not backwards, but forwards, with dignity, with health, with vitality, with longevity, what does that mean? What does that look like? I mean, obviously we can see you, but what does it look like kind of day to day, week to week, year to year in practice?
Yeah, so that's a great question. I feel like, especially in the aesthetics treatment room, I'll see patients come in and, they're looking at their face and wanting to make subtle tweaks to do that kind of improvement. However, I believe too that it's really super important to make sure that we're keeping our mental health well, right? There's a lot of stressors that we're facing. I don't want to just limit it to females, but as men and women, we're daughters and sons of aging parents. We're parents also of children. We are friends, we're sisters and brothers to, our family members, caregivers. And, there's a lot of different roles. And then let's factor in that we've got to work and we've got our work families and work relationships and then all of your other friendships and relationships as well. So I think there's a huge mental health aspect that people should be mindful of. And then also our physical nature. So, getting out and moving, the big thing is, as again, an aging female myself, it's bone density, right? It's, making sure that my frame is strong to be able to carry me into, my future. So I think that there's a lot of different moving parts with the aging process. And, it's funny because I just went today for a consult with a doctor and he's like, well, what brought you in? And I said, well, vanity. I mean, you're a plastic surgeon. It's vanity, right? And so he goes, oh, I've never heard anybody actually admit that. But I think that there's so much more that goes into our health and our wellness. And yes, looking good is very important, but it's also feeling good and feeling healthy. And, as you're aging, of course, you've got those body aches and those things that are happening, but you want to make sure through nutrition and making sure that you're making mindful choices of whatever you have to do for those mental tune-ups to keep your sanity.
Yeah, and I mean, it really is something, I believe, that touches all five pillars. So, if you have toxins in your body, the movement, the sweat, getting those out, you're going to have healthier skin. If you're fueling your body with better nutrients. I think there's studies that people eat a good amount of turmeric, they get this kind of golden glow that people rate, that you don't necessarily see it, but they rate them as looking healthier if you're getting the right nutrients. Sleep. I mean, we know the lymphatic system will wake up if we don't have a good night's sleep. Our lymphs are swollen. We get puffy eyes. We look puffy face. We don't look as healthy or as good. So, and then if you don't feel good about how you look, and this may be a societal problem and we need to address, et cetera, but most people, if you don't feel good about how you look, it creates stress. It impacts your mindset. And then that can lead to social connection. I mean, maybe we are a vain society. Maybe we are a superficial society, but better looking people can have more friends. They get job offers more frequently. They make more in the marketplace. So it does better for you in terms of social connection as well. So it's not this separate thing off to the side. It is reinforced by and reinforces every pillar we have. And so I guess understanding that, what is for you, right? Like you mentioned going to a plastic surgeon, doing a consult, like there's a work side of it, of outside. What are the, again, day-to-day, week-to-week, maybe year-to-year practices you say, hey, this is something I do? So for example, for me, I've gone through my 5 pillars, but one thing I do maybe for vanity is the BBL twice a year. And as someone who swims outside a lot and everything, like it helps a lot. I would have a lot more sun damage and spots if not for that. And that's something whether it's vanity or not, I say, hey, this is something I'm committed to doing for my skin health.
Yeah, for sure. I mean, well, I love the broadband light for sure. Definitely targets those for people who don't know what BBL is. BBL and IPL, same. They're going to give you the same as like Coke and Pepsi. The result is targeting those brown spots, those age spots, the freckles, as well as it can target reds too, because oftentimes when you see browns, you're going to see reds also. And it's for people who have spent time outdoors, swimming, love that. Or, people who are just living in warmer climates. I'm in Michigan, so we don't have as much sun, unfortunately, as others. But yes, I tell my patients, let's do fall cleanup, right? Come on in, let's clean up your skin and make sure then that we're combating the aging process and giving you a lighter, brighter glow. And also too, you get those actinic keratoses, the broadband light is going to help with possible precancerous cells too. So definitely all encompassing with that. And whether it's vanity or, just you wanting to feel better about yourself, either way, I think it does go hand in hand. I have patients who come in who might have a deep crease in the center of their brow. And they're like, everyone keeps asking me, am I mad? Am I angry? And they're like, I'm a very happy person, but they might grind their teeth. They may furrow their brow. They're a deeper thinker. Maybe they spent years outside, where they were frowning and making that face a little bit more. But it does give off the appearance that perhaps they are angry or, unapproachable. So putting a little bit of Botox there. I also, it's a high risk area, but with safe practice, you can inject filler if there is an indentation there. And it is transforming when a patient comes back and all of a sudden they go, so I used to have one of those, I'm going to date myself, but literally I looked like a phone booth where you could put a quarter. And it's because I had a scar there. I fell when I was young and I had lost tissue and I just needed it corrected. So, she came back to me and she said, oh my God, I cannot believe how much you've changed my life. She goes, no one's asking me anymore. Am I mad? She goes, I feel like I look happier. I'm not frowning all the time. And, just that little bit. And then she's walking around with a little extra skip in her step that ordinarily, again, because if you're feeling like you look like you're angry, right? You're giving off that vibe, then people are reacting to that. And then you're also becoming more self-conscious or insecure. So it's a big circle, right?
And our mood can follow facial expression. So they have those studies where people hold the pencil in their mouth and it forces a smile. They're subjectively rate themselves as, oh, I feel a little happier. And I imagine the same thing if our face or muscles or tissues have kind of over time gone to that it could put us in a worse mood. I can relate to this, not in the exact same way, but my swim coach all in college thought I just always had this terrible attitude when they would give sets on the whiteboard. They would draw them up and it was my facial expression. And it wasn't until late in my junior year, I got glasses. I just couldn't see. So I was always squinting and I didn't know. And so I didn't know what my facial expression was. He thought I was denigrating the practice he was designing. I was just trying to understand what it was because I couldn't see the things he had written. So I understand how it can really impact your interactions with other people.
Yeah, there's actually a study out too that Botox makes you happy because you have to think too, if you're constantly frowning, again, maybe it's eyesight, okay, maybe it's even migraines, and you're walking around like this, it's triggering your brain to think that you are unhappy. So they've said that it does, as soon as it relaxes that muscle, that you become a little happier too. And you know what? I'm going to go with that, Andrew, because I like it.
Fantastic. Well, it's good to have the science to support it.
Yes.
And I do want to get to more interventions like Botox for something like that, or fillers, or BBL or IPL. But before we do, could we go through kind of a baseline day to day or week to week of like in the morning, maybe something around hydration of, hey, we know that this is what it does for skin health, some kind of the types of cleansers to use or serum or like what that kind of daily practice to take care of our skin health and our aesthetics, because it is our largest organ. And what should we be thinking about?
Yeah, so definitely good point because do you know the majority of us are walking around dehydrated? So we're not getting enough water. And what people don't understand is, yes, okay, we've all heard drink those 8 ounces of 8 ounces of water a day. However, you need to factor in, if you drink a cup of coffee or, I don't like soda, but if you're going to drink pop or anything like that, that also dehydrates you. So it cancels out one of those glasses of water. So you would have to supplement that. So the majority of us are walking around dehydrated. And yes, our skin is our largest organ and it's made up of 90% of water. There's studies too that shows the first thing you should do in the morning is drink a glass of water. It's good it bathes your kidneys and, all of your organs. And it is going to hydrate your skin. You're going to have a little bit better skin elasticity and reflective properties. However, it's only going to do so much, right? So again, I'm in a colder climate right now and our heat is kicking on and not all houses have humidifiers or are balanced well. I've got a humidifier even next to my desk. It was so dry in my office yesterday because the radiant heat was kicking on in our building here. And that's where your skincare with your moisturizers. So there's hyaluronic acids that you can put topically on your skin. And I'll advise my patients first thing in the morning. So with the routine, and I love that you brought that up, is if you wash your face really well the night before, and that's a double cleanse, and then you're putting on all of your products, because earlier we spoke about how when you sleep, you heal and you repair. And sleep is one of the most important things that we can do also for our skin as well as our body. But you go to bed, your skin is cleansed, you wake up first thing in the morning, drink your glass of water, just splash tepid water on your face. If you've done everything the night before, there shouldn't be anything on your skin that's dirty or needs to be removed product wise. So what I like to do is I'll just splash cool water on my face, pat dry, and I let my own natural oil protect my skin. Then I'll go ahead and I'll put my hyaluronic acid and HA product that we have all over my skin. And then you want to make sure that you layer it and you put your moisturizer, your daily moisturizer over top of that hyaluronic acid. And the hyaluronic acid will bind 1,000 times its water weight. So it's a nice humectant. It's going to pull moisture from the air throughout the day. And then you put your moisturizer, hopefully with a sunblock, on top of your skin. And then whatever else you need to do, whether you put on makeup or, your tinted moisturizer and go about your day. But I love a hyaluronic acid for that, especially for a drier skin. And the other thing is knowing, so I know we were talking about your daily, but it's also important to know your seasons, right? So your skin, because again, it's your largest organ, it is also constantly changing. It's, not one stop. So it might be one way in the spring, different in the summer, and again, different again in the fall. So it's something that you should constantly be reevaluating.
Most corporate wellness programs overwhelm employees with too much, or they offer too little to be useful. Alively gets it right. We start with each employee's data and goals, then serve one clear, personalized action at a time. No noise, just real behavioral change. The outcome? A healthier, happier workforce, a measurable impact for your business. Visit alively.com to see personalized wellness in action.
What about maybe not daily, but I've heard and been recommended and personally use like retinoids or retinol on a more episodic basis, maybe every other day, and depending on the potency?
Yeah, another great question. So, I think everybody should be on some type of retinol, and a retinol would be more of an over the counter strength, and a tretinoin would be your prescriptive strength that you're going to get through a doctor. And the differences are, and the best way that I can explain it is if I go to CVS and get an ibuprofen or an aspirin, that's a certain strength. But my doctor might prescribe a Norco, which is a higher level painkiller. That's going to be more of a medical, right? A stronger prescription. So there's a difference between what you would purchase, which would be a retinol, whether you go to CVS or the mall, Sephora, Ulta, and then you get a prescription strength tretinoin from either a prescriber, whether it's a dermatologist, a plastic surgeon, or a med spa like we are. So what a retinol or a tretinoin does is the best way that I like to explain it is it can do some correction. So it'll fix your past sins as well as prevention for your future self, which will thank you for using that retinol or that tretinoin because it is a cell turnover rate product. And originally it was developed for an acneic skin. And then what they found was it had anti-aging properties. And that is going to help with the correction of some fine lines and wrinkles. My patients who struggle with acne, I love for them to be on a prescription strength tretinoin. Those though who may be a little bit intolerant and, like my daughter, she's 30 and she's like, you know what, mom? I can't be like giving a presentation and I rub my nose and my face falls off because it's flaking from the tretinoin. I'm like, okay, then let's do a retinol. That's going to be buffered. It's going to be a little less strength. So you got to kind of play around with it. And that's why I say, there's some things that you can DIY, do it yourself. But then there's others that you should really seek a professional to kind of guide you and give you, do a skin assessment and figure out what would be the best product for you. But I'm 53. I've been using a Retin-A since my mid 20s. I feel like I don't have a lot of lines on my face because I don't do a lot, but the things that I do try to do is always good skincare, take care of your skin, and Botox. If you can stop the muscle from moving, then you're not going to get a line.
Yeah, I mean, you don't have to fix damage if you stop the damage
Right.
before it occurs. You mentioned products, and I'd be curious, kind of top impactful, useful, and then maybe top, hey, these may be hyped, but they're not impactful and useful. And I'll start with a couple examples of things that I do, and one that I've recently learned I should stop doing. But like a retinol vitamin C mask, I do each week a red light therapy or like a red light mask or something. But then I had a microabrasion device, and the company that had sold, I went to the site and they weren't even selling those anymore. They had moved to red light mask and all this, and they didn't even offer. I was like, I should see, has this been debunked? And it basically was. It was that the theory, I guess, was, hey, causing the damage would stimulate collagen building and do all these things, but actually it was just causing damage. And so for however many years, I guess it seems maybe I was not doing myself any favors with this microabrasion treatment.
What was it? What was it, an at home?
It was an at-home microabrasion. Yeah, I would do it like almost every week.
Oh yeah, you're scaring me.
Yeah. So I mean, the best time to have learned it would have 5 years ago. The second best time was right when I discovered it. So I stopped doing it.
Yeah. Right. Well, that was 5 years ago was COVID when we were all locked down and we were all trying to DIY. So,
Yeah.
those derma rollers and everything, yes, theoretically they sound great, but like when we do microneedling here in our office, you're using a disposable tip. Every patient gets their own tip. It's a one use only. So when you're done, you throw it away. And I guess for layman's terms, it'd kind of be like a jackhammer, right? It's up and down, so it's perpendicular. So those needles are going up and down and penetrating that skin in a controlled fashion. So when you're using a derma roller, you're rolling it across the skin and you're actually dragging it and you're tearing the skin, as opposed to those controlled micro disruption to the exterior of the skin, the epidermal layer. So that's where you kind of can, and then you got to think bacteria too. So like, I'd have patients come in, oh, I have my derma roller. And I'm like, oh, if you don't properly cleanse and prep your skin, and then if you don't store it correctly after, and then you have to think every single time. So like when I inject a patient with Botox, even when I do filler, I change my needle 3 to 4 times when I'm injecting, because every time I'm injecting, I am dulling the needle every time it is penetrating that skin. And I don't like to bruise my patients. It's very rare that I do, and I really take pride in it. So I'd rather get a new needle and inject a different area each time, so that I'm reducing the trauma to the skin. So the derma rollers, unfortunately, you're using that same modality continuously and you're dulling it. So not only are you causing micro tears, possible bacteria, but it's going to just wear down. So, but we're not going to hold that against you, because I love that you are being proactive.
Yeah, trying, and just want to be proactive in the right direction. So from
Yeah.
your facial expression, it sounds like red light therapy, you are a fan.
Oh, I love red light. So, I was a little skeptical at first. I try not to hop on the bandwagon. I feel like people get excited and then they start throwing all these things out, and everybody's got to do it because it's the hip, the buzz thing to do. And then a year from now, we find out like, oh, really, that wasn't a good idea. There is a neurosurgeon. His name is Jack. And of course, because I'm on the spot, I'm not going to remember his last name. But he talks, he's been on Joe Rogan a lot, and Huberman and Gary Brecka. And he has spoken about, red light is actually like going outside and having the sun. Right?
Jack Cruz, is this Jack Cruz?
I think it is Jack Cruz. Yes. Have you listened to him?
I have, yeah, because he was on Rick Rubin. I think he kind of co-hosts a podcast with him as well. Yeah.
Yes, I was fascinated. And at one point, he was like, you know what? If I could have done surgery outside and controlled it, I would have, because the red light and the light from outside had all of these healing properties. So when I started looking into red light, I have the mask, I have the neck, I've got the pad also that I lay on. And when I've had patients who have even gone in for cosmetic surgery, I'm like, you need to get a red light panel and sit in front of that red light panel. And it really does, it stimulates that mitochondria, all of the collagen, the fibroblasts, and it really does help to stimulate the skin. So as well as going down, I was a IFBB pro, and I did a couple of triathlons. And, your body, it can take some of that abuse, but there are days that I feel it a little bit more. So I get out and I lay on my red light pad and body pad, and it's amazing. So I'm a big believer in the red light.
And masks? So sorry, not red light masks, but like different, like the retinol, vitamin C, different nutrient masks.
So I think, anytime that you're doing something for your skin, I love masks. I think you can buy them, and put them on your face at home. I like to sit and have a glass of wine myself and have one. There's, again, it's what specifically is it that you want to target? Your vitamin C's are going to lighten and brighten. They're great antioxidants. You can buy a hyaluronic mask if you're a little bit dry, and put that on. You've got retinol ones, kojic acid or azelaic acid, that can really help to target discoloration for the skin. So absolutely. I don't think there's anything wrong with that. I think that's great. And, there are things, I do think it's important to do things in the treatment room, but I think it's just as important to do your home care also. So, I think masks are great.
And what about supplements? So we talked about turmeric can kind of give you this glow, or
Yeah,
collagen, has become a big thing. I take collagen every day.
yeah.
But anything that people should make sure that they're consuming or try to consume, or make sure they're avoiding or try to avoid when we think about skin health and aesthetics.
Yeah, definitely, turmeric, you've got that golden glow. That will definitely help. It also helps with inflammation. I think that's amazing. Supplements, vitamin C. I always put together a protocol. I was in plastic surgery for a long time, and there's a lot of things that we tell patients not to take before surgery. However, there's some really good supplements that you should take post surgery, such as vitamin C, vitamin D. Vitamin D is going to help with your immunity, but it's also going to help with your skin. I do collagen is great. I do a lot of Sculptra here in my office. A lot of my patients are on GLP-1s, your Ozempics and your Wegovy's. They've got facial wasting. We're putting Sculptra in their face to stimulate that collagen. And then I'm like, if you're not pairing it with those building blocks right at home, which is your amino acids and your collagen stimulators, which would be your collagen powders. I think that that's very beneficial as well. What other supplements that I can say that are FDA approved? Because
Okay.
I love my GHKCU. They're seeing a lot of that topically is being added. It's a great copper peptide. I think it's youth serum in a bottle. You can take it also orally. They have injectable GHKCU. I love BPC 157. That's amazing for inflammation, both for your body if you're a big athlete, or working out, as well as healing.
The GHK one, is that something you would also inject, or you do orally? Like what is the way you take?
You can inject it. However, a lot of people are not always comfortable injecting. You can do sub-Q or intramuscular. You'd have to go through a peptide company. My 2026 goal for Our Skin Aesthetics is to get into Our Skin Wellness. I do the peptides myself personally, and I know the benefits that they have. So that's something that I'd like to be able to bring for my patient population. But yes, you should look into, because you're very well versed, you should look into the GHKCU.
Okay.
It actually helps with telomeres also, and heart health. There's a lot of really good science based data on it.
Okay. Yeah. I will definitely go out and deep dive on that, because I knew BPC 157, but this
Oh,
one was new
love
to me.
it.
So,
It's
yeah.
magical.
I had a shoulder injury for 2 years, did not get better. Went MRI and multiple orthopedic surgeons. And it's supposed to take 2 weeks. And literally within 3 days, I was moving my arm in ways I hadn't in 2 years. This is kind of crazy.
Okay, have you looked into TB 500 also?
I have, the concern is where a lot of people are saying, hey, what's labeled TB500 is oftentimes TB4, and TB4 can stimulate all kinds of growth, which if you have a tumor or cancer can be dangerous. And I've had multiple malignant melanomas. And
Okay.
so on the off chance I have something else going on, I'm just trying to avoid that one for now.
Yeah, and again, that's where you have to be knowledgeable, and you have to be with a responsible provider, right? Like, so I have NAD here also. I'm a big believer in NAD. But again, like you just said, it's a contraindication. If I have a patient who comes in and they've had any malignant tumors or health issues, generally speaking, that's where I'm like, I have to defer. You have to go to your primary care or your physician who you've had a relationship with before and get clearance, because again, do no harm, safe practice. But NAD is an amazing supplement, and whether you want to inject it or take it orally, I really do believe that that's a big that gives you a really good glow.
Yeah, and I don't know if you know the patches, but like Ion Layer is a company we've worked with that you can do patches, and it's this ionized thing and comes in over time. So not quite as extreme as an IV or an injection, but maybe better than orally and some of the others.
Yeah, I did see those advertised and I am going to look. I'm glad that you mentioned that because I am going to look into those because, yeah, with the IVs, aesthetics is medicine. And I can't, if anybody wants a takeaway, is you need to make sure just because they hang the sign med spa, that they really do take into consideration patient care and safety because the aesthetics industry is growing exponentially, but you want to make sure that there's a lot of charlatans in the industry also, and you want to make sure that you connect with the right provider.
For sure. And as we kind of get in that realm, because we started on things maybe by over the counter, you're doing at home on your own, and now then we were
Mhm.
getting a little more arcane with the peptides. But what about actual more, I don't know if the right word's invasive or more impactful procedures that you see as the highest impact? We've touched on BBL and IPL, we've touched on Botox, but what are the things maybe at different life points or different problems that you say, hey, these are kind of the top handful of procedures we do in the benefit and impact?
Yeah, so definitely again, I think my first go-to always is Botox, right? Because if we can relax the muscle and get some lift and some correction and some softness, that's key. And I like to treat my patients with Botox first, get that all over look, and then have them come back, and then I can see really where the lines are that maybe we need to chase with filler. Impactful for skincare, I love microneedling. I think it's very undervalued. I think minimal downtime, minimal recovery, with a huge impact because you can correct anything from surgical scars to acne scars to childhood scars, as well as pigmentation and soften fine lines. And not only are you doing some correction, but you're also getting prevention because you are stimulating collagen. And then my other big workhorse is the CO2 laser. The CO2 laser, you are going to have some downtime. It's not going to target pigmentation so much like your IPL or BBL, but I do think CO2 laser is great for that a little bit stronger resurfacing to the skin. So that's pretty impactful. And I really think that aesthetics is going, we're getting away from those fuller, puffy, caricature looking faces and getting into a little bit more of regenerative, which would be my Sculptras and my Radiesse because those products are collagen stimulating. So, I mean, I know I kind of threw a lot at you, but I think there's different categories for everything. And, I don't think that people need to be, again, if you're in the right hands with the right provider, you shouldn't be fearful that you're going to walk out and look like a completely different person because my belief is if you are with the right person and you're doing it correctly, you should just look like you went on vacation.
Yeah, and I think that was really important thing you were kind of pointing out is the trend getting away from, hey, I want to look different and be different than I am, to I want to get to a healthier looking version of myself. Because as we age, right, we have less collagen, we have less fat stores. And so how can I get to this more youthful, healthier, vibrant, moist skin, everything hydrated, I guess is the better word. And that work in this space, I appreciate everything you're doing there to help people.
Yeah, thank you so much. And don't complicate it. It's simple. There is something to be said that keep it simple, silly, right? Or yeah, I think is that the saying?
Keep it simple, stupid.
Yeah,
Yeah,
yeah.
yeah,
Well,
yeah.
I don't want to call anyone
You
stupid,
were being
but I
nice
mean,
there.
there
Yeah,
are some moments where I'm like, okay, but
yeah.
just keep it simple. You don't have to. You go in somewhere, and I always get frustrated. People come in with a bag of these products that they purchased, and it's filled with 20 different products, and they're like, when do I use this, and how do I use this? And I'm like, oh my god, I'm like, I'm already overwhelmed and having anxiety just looking at this bag with all these 20 products. I don't think that's necessary. Simple. You just need your core products. Wash your face before you go to bed at night. I don't care if you've been on a bender and you've been enjoying yourself and you can't even see the sink. Okay, wash your face with soap and water twice. Do a double cleanse. Again, to circle back to what we spoke of in the beginning, your repair time is when you go to sleep. So you want to think putting your treatment products on while you're sleeping, skin's repairing, right? And then you wake up in the morning, splash your face, put your stuff on, and get out the door. Life is too short to be, I've got these parents who are coming in and they're like, my 9-year-old wants like system skincare and a refrigerator next to her bed. I'm like, are you kidding me? What are you doing? Go outside, color, find a friend, do something. Like, get off of TikTok with these products. So just keep it simple.
That is a beautiful place to close. Keep it simple, keep it beautiful, keep it healthy, keep it youthful. Thank you so much, Raquel, for joining us today and for all the work you've been doing over the years.
Thank you, Andrew, for having me. It was a pleasure. And I'm going to look at those NAD patches.
Thank you for joining us on today's episode of the Home of Healthspan podcast. And remember, you can always find the products, practices, and routines mentioned by today's guests, as well as many other Healthspan role models on alively.com. Enjoy a lively day.